I'll just go over this particular article on a diagnostic test, not as an expert in diagnosis because I am not a radiologist, but as someone, as a clinician who would suggest this test to a patient. So as an outsider, we are looking at diffusion diagnostic value of diffusion tensor imaging derived metrics as biomarkers of cerebral changes in developmental delay. Developmental delay is a catch-all phrase that is commonly employed by clinicians for any child who has not met milestones, and fortunately or unfortunately, this tag happens to sometimes hold even until they're in their teens. So as someone who would be dealing with these children, this article is of interest to me, not as a radiologist, and therefore many of the things that are written in this article are not something that I would understand. However, if I was going to evaluate this, appraise this article on the START guidelines checklist, this is what I see. START, the first item is title or abstract. Is the study identified using at least one measure of accuracy, such as sensitivity, specificity, predictive values? Now here it says diagnostic value, and I would say okay, it's acceptable. The second, on the abstract, is there a structured summary? Yes, there is a structured summary. Coming to introduction, is the scientific and clinical background, including the intended use and clinical role of the index test, mentioned? Yes, the index test, in this case DTI, in the introduction they have said is likely to be more accurate than the reference test or MRI. Were the study objectives and hypotheses mentioned? Yes, it is mentioned. They want to find a more accurate test so that the children are easily identified and sent for relevant early intervention services. So objectives and hypotheses are sound. Coming to methodology, was the data collection planned before the index test and reference standard was performed? From the article, yes, it is a prospective study. They had a plan. Eligibility criteria is mentioned. On what basis were potential eligible participants identified? They were identified based on clinical guidelines of developmental delay, that is based on symptoms. Where and when were the potentially eligible participants identified? That is mentioned. It was in the hospital, those who were sent to the radiology department. It is mentioned. Were the participants consecutive, random or convenience? It is mentioned, their convenience. The index test, in this case DTI, has this been described in sufficient detail? For an outsider, a non-radiologist, it seems to have been mentioned in detail, but I wouldn't really know. Reference, is a reference standard in sufficient detail? They have just mentioned routine MRI. There is not enough detail in this article. Rationale for choosing the reference standard, it is what they have mentioned, that it is routine. It is what is routinely done. So the rationale is mentioned. 12A, definition of and rationale for test positivity cutoffs or result categories of the index test. They have mentioned some 3 mm slices. Now, not being a radiologist, I am not able to make make a judgment on whether this is appropriate. So I'm assuming it is appropriate, especially since they have said that it is based on proprietary software. So we'll say yes. Definition and rationale for test positivity, distinguishing pre-specified from exploratory. Again, I'm assuming it is all right. Whether clinical information and reference standard results were available to the performers. Yes, it was available. They said that they had used the clinical guidelines of clinical diagnostic criteria for developmental delay. So 13A and B, the answer is yes. So far the article appears to be following the START guidelines. Now we come to analysis. Methods for estimating or comparing measures of diagnostic accuracy. They have used the mean, and they have used the mean of the index test without any reference to any other reference test. So they have only used measures of central tendency between the cases and controls as divided from clinical guidelines, and that is the only analysis they have done. So I am wondering if it is not too simplistic and if it is adequate. Indeterminate index test or reference standard results were handled. There is no mention of the reference test results, that is the MRI test, that is not being handled at all. And how was the missing data on the index test and reference standard handled? There is no mention of this. Is there any analysis of variability in diagnostic accuracy distinguishing pre-specified from exploratory? Not mentioned. How was this sample size determined? Not mentioned. It appears to have been convenient. So there is no determination of power, and the only analysis done was a comparison of case and control using comparison statistics and measures of central tendency. So the data analysis appears to be inadequate. Coming to results. Using flow of participants, no, there is no flow of participants. Baseline demographic and clinical characteristics has been mentioned. Distribution of severity of disease, not mentioned. Distribution of alternative diagnosis, not mentioned. This is especially, it is important here because they have had children who are much older, in whom an alternative diagnosis should have been mentioned by that age, because they had children as old as 10 and 11. So by then an alternative diagnosis should have been established. Time interval and any clinical interventions between index and reference standard, not mentioned. Cross tabulation of the index, this again is the previous question 22 is again of importance, because there should have been a lot of clinical interventions that have been done since the initial MRI, which must have been done at the age of 2. So that is of concern here. Coming to test results, cross tabulation of index test results or their distribution, they have only given central tendency. Estimates of diagnostic accuracy and their precision, not given. Confidence intervals is not given. Adverse events from performing the index test or the reference standard, a brief mention was given. Coming to discussion, study limitations, sources of potential bias, statistical uncertainty, generalizability. They have said that the reference test is inadequate. More than that, they have discussed the index test in great detail, in great technical detail. Implications for practice, including intended use and clinical role of the index test, is somewhat mentioned, in the sense they have said that DTI is probably more useful than MRI. Other information, registration number, name of registry is not given. Where the full study protocol can be assessed is not mentioned. Sources of funding and conflict of interest has been mentioned. So although this test, the study has been following the START guidelines until analysis. After that, it seems to be of questionable integrity, because the analysis and the comparison groups and the comparison with the reference test is inadequate, and when we go into the results and the analysis of the participant criteria, there seems to be a lot of questions or lot of lacunae. So if you are going to follow a appraisal tool like the STAR, STAR checklist, this article is not as relevant as one would assume by reading it without a critical appraisal tool.